This is another teen trend. Parents and school administrators across the country are on high alert. Teenagers are using a vaping device with super high doses of nicotine. This is being referred to as juuling. And I certainly know that a lot of parents have been talking about this before it even hit the headlines, because if you look at this, this looks like a little USB device.
Yep, like a thumb drive.
You know, oh mom, I'm just doing homework, just saving stuff on my USB drive. And my concern with this is we have normalized vaping so much that I don't think anyone sees any harm in it. I think the kids feel like this is a benign thing to do.
The U.S. Centers for Disease Control revealed today that one person has died and nearly 200 people have developed severe lung illness linked to the use of e-cigarettes.
Health officials in Oregon are now reporting the second U.S. death believed to be linked to vaping.
Doctors in Oregon say the middle-aged man smoked marijuana through a vape pen, developed breathing problems, and then died at the hospital.
A fourth death has been reported from a severe lung illness linked to vaping.
There are now 5 deaths reported in the United States, and the number of serious respiratory illnesses suspected of being linked to vaping has more than doubled to 450 now in the U.S.
6 deaths are now connected to a growing public health crisis tied to vaping.
An urgent new e-cigarette warning out tonight, with 450 people getting sick from vaping in 33 states. The American Medical Association is urging people to stop using e-cigarettes.
And also tonight, the stark new warnings for e-cigarette users. Health officials in one major American city advising to stop vaping immediately as the number of illness potentially linked to e-cigarettes grows.
Anthony, good morning. Well, the city's health director is calling these illnesses an outbreak, and the CDC is reporting at least 33 states and the U.S. Virgin Islands have cases of this severe lung illness directly tied to vaping. Hawaii and Idaho announced their first cases on Tuesday. Now, some of these involve vaping both nicotine and marijuana, and this morning the fear is the number of cases will rise.
This is a new outbreak which is occurring across the nation.
Houston's health director talked about the expanding epidemic tied to vaping. Its exact cause still unknown, but in 3 confirmed cases, there's one specific connection.
What are the commonalities in these cases?
So the commonality we're seeing in these cases, unfortunately, is that all of them are young people. This is the age when people start making their life choices, and this is a bad choice.
The CDC reports more than 20% of high school students use or have used vaping products. 17-year-old Whitney Livingston was hospitalized 2 weeks ago in Dallas. She and her mother blame her 2-year vaping habit for her severe lung injury.
The ventilator was the best thing because she could not breathe on her own.
Research published Friday in the New England Journal of Medicine, the first 53 cases of this illness are discussed in depth. All patients were healthy, mostly men with a median age of 19. Most had to be hospitalized, and nearly half required intensive care. Investigators now believe these illnesses have all been caused by an exposure to some kind of chemical used in the vape juice inhaled from e-cigarettes. Exactly what substance is still a mystery, though lab tests have shown the chemical vitamin E acetate in a number of patients.
It's actually a product that's used commonly as food supplements, in skin creams. But frankly, we really don't know what the consequences are when you heat it and inhale it.
We do know that inhaling oil can lead to a condition called lipoid pneumonia, which is exactly what doctors say the patients across the U.S. were suffering from.
Doctors are worried about the safety of electronic cigarettes after seeing cases like this. A healthy 17-year-old in Texas who ended up in intensive care with an unusual lung disorder.
I woke up just throwing up everywhere, and my heart was just pounding out of my chest, going 100 miles an hour.
Tonight, new alarm about the risk of vaping after an emergency at this Houston area high school. Officials say a student was suddenly sickened after vaping.
A girl had handed it to him. He hit it, he passed out, and he would not wake up. So the ambulance had to come get him out and stretcher.
One after the other.
My lungs were just felt like a baby bear was on them.
Young, healthy adults hospitalized with severe respiratory illnesses.
I was having a really hard time breathing, joint pain. Like I couldn't walk very well.
So sick, they're being put into medically induced comas.
I had no idea what was happening inside my body.
The cause? Vaping. The FDA slamming popular e-cigarette maker Juul for illegally advertising its device as a safer alternative to cigarettes. The agency calling JUUL out for marketing directly to students, citing a high school presentation describing its device as totally safe, delivering smoker satisfaction without the harm. Reminiscent of when cigarettes were first marketed as safe, even friendly. JUUL says it is reviewing the letters and will fully cooperate. Lawmakers across the country calling for action.
Previously healthy young people are getting seriously ill because our Food and Drug Administration in Washington has failed to protect them from the dangers of e-cigarettes.
No one should use vaping products, period, until we know what it is.
One Alabama high school taking extreme measures after a student was found passed out in the bathroom after vaping. The principal removing doors off stalls in the boys' bathroom, which some parents say is excessive. Scrambling to find solutions to a growing health crisis.
I did defending because everyone else had one.
And that landed 18-year-old Adam Hergenrader in the hospital. After vaping for a year and a half, doctors say Hergenrader has a severe lung injury and needs a supplemental breathing mask.
I didn't think that little pod could do so much damage.
Dr. Scott Abereg sees the harm on x-rays. Dark areas represent healthy lung tissue, white, trouble.
That represent the inflammation that's going on in this particular patient's lungs.
Today, North Carolina revealed 5 cases of vaping-related lipoid pneumonia. Scientist Irfan Rahman is using this vaping machine at the University of Rochester to figure out what role THC vaping oil plays in such a life-threatening illness. So this is going into your lung?
This is going into the lung.
The machine shows how the vapor leaves oil droplets in the lungs that can irritate and inflame, causing potential respiratory failure. One more clue to a still baffling mystery.
18-year-old Seema Herman vaped nicotine, then THC over 2 years, getting sicker and sicker, ending up on life support on a ventilator.
It was terrifying. It's just getting weaker and weaker by the minute.
Doctors put Seema in a medically induced coma. When she woke up, she asked to write this message on Instagram, now seen around the world.
I'm just trying to share my story and save people's lives.
Nursing student Aubrey Butterfield learned the hard way vaping can make you sick.
I was just sick and sick, kept getting sicker, and I didn't know what it was.
This summer, the 25-year-old was diagnosed with a lung injury tied to vaping. At New York's University of Rochester, Dr. Daniel Croft is seeing some cannabis vaping patients with a unique form of pneumonia called lipoid pneumonia. He suspects it's caused by the oil used in cannabis vaping.
When the oil is heated, it forms an aerosol and is able to travel into the lung. From that very hot initial temperature, as it cools, it can condense into the larger droplets and then stick to the walls and then coat the walls.
So the lining of your lung could be coated with fat because you vaped?
It could be. That's the concern.
And so basically it's rendered your lungs useless.
Your lungs fail.
And this one is particularly terrifying because it comes in flavors like creme brulee and mango that are meant to be appealing to young people. But one of these pods is actually equal to 1 pack of cigarettes.
That's a lot of nicotine for a child. We know that nicotine has a negative effect on number of things in terms of developing.
And you can convert this to marijuana.
Yeah, you can use this for THC oil. And actually, interestingly, to your point, that people don't realize that this is even vaping, parents included. The young people are even more unaware of what they're doing. 25% of 15 to 25 to 24-year-olds who are asked if they're actually vaping said, no, I'm just juuling. And they had no idea that that's actually what this is.
Sleek, sweet, and socially acceptable.
I think I was just fascinated by it.
E-cigarette products like JUUL have become increasingly popular among teens, like these 15 and 16-year-olds.
Creme brulee.
And this is blueberry. You like the sweet flavors?
Yeah. I'm pretty sure every single one has tried, or maybe like 1 or 2 kids haven't.
Would you be more upset if you rolled in and saw your children using this or smoking a cigarette? I'm just curious.
I would actually be equally upset.
Yeah,
I would
think
be
that's a good reaction.
I think, I mean, we were talking backstage, and the producer of the show said that in certain parts of the country, for example, New York, people are doing this all over instead of smoking and think it's a much healthier,
in front of their kids.
In front of their kids, think it's a much healthier alternative. But I
Setting
think
a real bad example.
Exactly, and nicotine is so incredibly addictive, and I think that people really underestimate it's not just the smoke that's so harmful in these, it's the addictive quality that really fuels these industries and keeps them going. So
such a tough.
Why we always say communication with your children is so very important, certainly when it comes to all these new devices.
Keep an eye on what they're doing. That's your job.
You need pain when you breathe?
No.
This is not how Maddie Nelson wanted to spend her summer vacation.
They had no idea what was going on inside until they put me into the medically induced coma.
After 3 years of daily vaping, the 18-year-old developed a high fever and pneumonia. Her doctor thinks were caused by her habit.
I still have to be on oxygen at night, and I've just finished my prescription of steroids that I was taking, but other than that, I'm doing pretty good.
She's one of a growing number of people getting sick, leading to more warnings today about vaping. Indiana's governor targeting teens.
So the best thing that we can do is to make sure they never start.
And Milwaukee's health department joining the national chorus, urging people to stop after 16 users were hospitalized with a type of pneumonia caused by poisons or toxins.
Just because they are safer or perceived to be safer than cigarettes doesn't mean they are safe. And I think we're now seeing clear evidence that that is not the case.
And Ann joins us now. Ann, good to see you. So what exactly is in this vaping liquid?
It's a whole big chemistry pile along with nicotine and flavorings. There's something called propylene glycol. It's used in antifreeze, perfume, and that artificial fog that you sometimes see at concerts. While generally considered safe, Kristen, as one doctor said today, it is a chemistry experiment every time you inhale.
Dr. Torres is here now, and until the FDA takes action, what can we do?
And Lester, some states are already starting to take it into their own hands right now. For example, New York announced new investigations and a plan that e-cigarette shops must post warnings. Michigan banned flavored e-cigarettes. And this is just a sign of things to come. States not necessarily waiting for the federal government to act.
This evening, an empire of illegal drugs. That's the description of a massive THC vape cartridge operation busted in Kenosha County.
Kenosha County Sheriff David Beth says Tyler Huffhines was packaging tens of thousands of THC cartridges to be used in e-cigs, possibly under the guise of being legal CBD oil.
Some people will say this is CBD. This isn't. This is concentrated THC. It's 157 times the potency of what the labeling says.
For much of the last 2 years, authorities say Huffhines employed at least 10 people to fill individual cartridges with THC from large mason jars of the liquid.
They found 31,200 vape cartridges filled already, ready to be shipped out. Each was filled with 1 gram of THC. There were 57 mason jars filled with THC oil. Each jar, according to Mr. Huffhines, is worth about $6,000 apiece.
In total, investigators took more than $1.5 million worth of THC products from a home and condo where they believe Huffhines was putting this all together. With news of deaths and severe lung illnesses related to vaping, he's putting out a nationwide request to work with them and see if Huffhines' stuff was linked to them.
Across this nation, we've lost 6 people. Hundreds and hundreds have been hurt. I'm very curious, and we're willing to work with any agency in this country that has lost or seriously hurt somebody to see if our people here in Kenosha County have any responsibility in hurting the hundreds of people throughout the United States, especially in Wisconsin and southeast Wisconsin.